brought to you by IPCA Laboratories Limited. Different hypertensives wear different profiles, and different profiles require different antihypertensives, making your choice for the right antihypertensive difficult. Whatever be the hypertensive profile, diabetes, renal impairment, gout, congestive cardiac failure, coronary artery disease, dyslipidemia, young, elderly and hypertensives with smoking and COPD, presenting the one antihypertensive, Prisartan, losartan potassium tablets, the one for all antihypertensive, works in all, for all and with all. American Heart Association says 50% of diabetics are hypertensive, and beta blockers and diuretics disturb glycemic control. For hypertensives with diabetes, choose Prisartan, as Prisartan blocks and reverses the vasoconstrictor effects of angiotensin II, thus insulin sensitivity. And American Heart Association says that Prisartan improves insulin sensitivity by 30%. The Nephron Information Center reports that 7 out of 10 times hypertension and diabetes are the cause of kidney failure. For hypertensives with renal impairment, choose Prisartan, as Prisartan is approved by the US FDA for delaying the progression of renal disease. That Prisartan reduces the risk of end-stage renal disease by 28% and the level of proteinuria by 35%. Moreover, with Prasartan, no dosage adjustment is required. Journal by Oxford scientists say 25% of hypertensives suffer from gout. For hypertensives with gout, choose Prasartan. As current medical research and opinion 2004 opines that Prasartan is the only antihypertensive with uricosuric effect. Also, Journal of Hypertension 2001 confirms that Prasartan reduces uric acid by 8% unlike neutral effect with irbesartan. American Heart Association 2002 says that 500,000 new cases of heart failure are diagnosed annually, and JNC7 confirms that hypertension is associated with 2 to 3 times higher risk of developing congestive cardiac failure. For hypertensives with congestive cardiac failure, choose Prasartan. As evaluation of losartan in the elderly, that is ELITE study, confirms that Prasartan improves survival by 46% and also improves functional capacity by 1 NYHA class in 56% of patients. American Heart Association 2006 reports 71% of coronary artery disease patients are reported to be on aspirin, which is likely to attenuate the antihypertensive potential of ACE inhibitors. For hypertensives with coronary artery disease, choose Prasartan. As unlike ACE inhibitors, Prasartan does not rely on prostaglandins to lower blood pressure, hence does not lose its antihypertensive potential with aspirin. The LIFE study confirms that Prasartan shows 13% greater risk reduction in first occurrence of CV death, non-fatal stroke and non-fatal MI as compared to atenolol. European Society of Hypertension, European Society of Cardiology says 44% of hypertensives are dyslipidemic and beta blockers and diuretics can disturb lipid profile. For hypertensives with dyslipidemia, choose Presatin. As Presatin does not worsen lipid profile unlike beta blockers. Moreover, Circulation 2004 reports additive effects of Presatin with statins, that is Presatin with statins improves endothelial function and reduces inflammatory markers. Joint National Committee 7 reports 66% of individuals develop hypertension after 65 years of age and 21% do not adhere to antihypertensive therapy. For elderly hypertensives, choose Presatin. As Drugs 1996 confirms that Presatin is well tolerated by smokers and in COPD. And Hypertension 1995 confirms that Presatin does not produce cough unlike ACE inhibitors. Whatever be the hypertensive profile, diabetes, renal impairment, gout, congestive cardiac failure, coronary artery disease, dyslipidemia, young, elderly and hypertensives with smoking and COPD, choose Presatin, the one-for-all antihypertensive, works in all, for all, with all. Presatin offers smooth sustained 24-hour BP control and hence the convenience of OD dosage. Also, Presatin can be co-prescribed with beta blockers, calcium channel blockers, ACE inhibitors, statins and aspirin. Moreover, Presatin is bioequivalent to international reference brand and Presatin is manufactured at the plant approved by US FDA and TGA Australia. Whatever be the hypertensive profile, diabetes, renal impairment, gout, congestive cardiac failure, coronary artery disease, dyslipidemia, young, elderly and hypertensives with smoking and COPD, Presatin, Losartan potassium tablets, the one-for-all antihypertensive, works in all, for all and with all.